Well, hello everybody. My name is Emily Bright with DocStyle.com. I'm hosting this webinar on behalf of DocStyle. Today, we'll share more about surgical spinal procedures done with Elliquence endoscopy. At the end of this presentation, viewers are invited to schedule a remote consultation with a doctor who performs this procedure. We will also be answering questions throughout the webinar to help you learn more. Okay, so let's begin. Patients that undergo Elliquence endoscopic spinal surgery can achieve excellent outcomes in up to 80% of all cases. Patients who opt for this procedure often do so to treat spinal pain caused by herniated discs, failed back surgery syndrome, spine degeneration, spinal stenosis, sciatica, spinal instability, facet joint disease, and bone spurs. Endoscopic spinal procedures performed with Elliquence are the least invasive surgical techniques. The surgeon makes a very small incision and does not need to cut or remove bone and muscle in order to perform the surgery. This procedure uses a tiny camera that's inserted through a small surgical port or tube to see the spine and small instruments that are used to perform the surgery. Because of this, the procedure does not traumatize the spine like traditional spinal surgeries. It can also be performed as an outpatient procedure using a local anesthetic instead of a general anesthesia. There are many benefits to this procedure when compared to similar surgeries. These minimally invasive procedures require a very small incision, which is less traumatic to the surgical area, there's little to no blood loss, and it requires less recovery time. The procedure also preserves spinal mobility while reducing the need for pain medication. These procedures specifically treat the spine. Let's take a look at the procedure. Step 1. A local anesthetic is used to numb the area and the patient may receive conscious sedation. Step 2. The patient is placed face down or on their side and the incision area is cleaned and draped. Step 3. A small incision is made over or near the area that is affected. Step 4. A small tube is inserted to pass the camera and instruments through. Step 5. The affected area is identified and visualized with the camera. Step 6. Under the guidance of the X-ray fluoroscopy and direct visualization, the procedure is performed. Step 7. The tube is removed and the incision is closed with a stitch or two. Step 8. The patient is then immediately transferred to a recovery room for several hours of observation. Most endoscopic spinal surgeries can be done as an outpatient procedure and last from 1 to 3 hours, depending on the procedure performed. Patients are discharged from the hospital or surgical center after a few hours of observation. They are encouraged to walk and move around as soon as possible, and physical therapy may be required to regain full movement. The patient will be discharged with instructions about bathing and resuming activities and can expect to be limited to light activities for the first 2 to 3 weeks. They will typically be able to return to full activities within 6 weeks. Endoscopic surgeries like this can carry some risk. Your doctor will discuss specific risks with you in more detail, but possibilities include injury to blood vessels or nerves in and around the spine, as well as failure to relieve pain. As with any surgery, bleeding, infection, and DVT are possible. The exact cost of this treatment depends on many factors. However, insurance typically covers all or part of this procedure, including both Medicare and Medicaid. If you would like to schedule a consultation to learn more about Elliquence endoscopic spine surgery, click our link to connect with a doctor. Thank you all for your time.